So, rehabilitation process starts with when people like you, members of the general public, who find a bird that they think is injured, they will call us and they will let us know that they have found an injured bird. We'll ask them questions. We'll get pictures of that bird, and we will try to determine if that bird needs to come into our hospital. If we think that bird is injured and it needs any kind of care, we will send out our raptor rescue team, our amazing volunteers who have signed up to go and pick up any birds from where they were found and bring them to our hospital. Once we get the bird into our hospital, we do an initial evaluation of basically their entire body. Now, you may have seen other programs at our facility where they bring out birds. Now, a big difference between our avian ambassador team and our rehab facility is I work with all wild birds. So these wild birds really, really don't like being around people. They get very stressed, they get very nervous. So I could not bring out a bird for y'all to see, but I do have an amazing stand-in here that will help me show you how we care for these birds. So, yeah, when we get a bird in, we do an initial evaluation. Now, what do you guys think is the most dangerous part of this bird? It's their beak. That is an excellent guess, but it's actually their talons. So, like if you are handling a mammal, let's say a cat or a dog, it's absolutely the most dangerous part of their body is their mouth. You don't want to get bit by a dog. You don't want to get bit by a cat. But when you're handling a bird, the strongest part and the most likely for them to damage you with is absolutely their talons. So when you're handling a bird, you want to get a good firm grip on their talons. So when we're doing an evaluation, there's one person holding the bird securely. And they do that by getting a good firm grip, making sure they can't move their legs. They also will take their arms and tuck their wings in because we don't want that bird flapping around because then it might damage its feathers trying to get away. We don't want it to damage its feathers. Then we get a good grip on its head. Now, I said the feet were the most powerful part, most likely to hurt you, but you absolutely still don't want to get bit by a bird. That still hurts a lot. So we get a good grip on their head and make sure they can't bite us. And now I am properly holding my bird. And then the other person would do an evaluation on the entire body of this bird. So what we generally like to start with when we're evaluating is our bird's head. So first, when we're evaluating our bird's head, we check for any blood in the nostrils, maybe anything we can see in their ears, any bruising in their ears, any bruising on their head, any blood in their mouth, in their beak. That might indicate that they're coming into us with some problems. Maybe they hit something, got hit by something. Our most common injury we see at our hospital is being hit by cars. So a very common thing is seeing that bruising, like in their ears, in their nose. After we check out all of those areas, we also check the skull for like any soft spots where we think they might have maybe hurt their skull. After that, we will look at their eyes. So I have two different skulls here. I have one from an owl and one from a hawk, and you can see there's a very, very big difference between these birds. So owls have very, very large eyes, and they have bone rings that hold their eyes in place. So if I were to want to look around, I can just try to move my eyes around. Owls can't do that. They have this giant ring just holding them in that position, so they need to move their whole head turn. Yeah, so they definitely have different eyes. When we're examining the eyes, we check the outside for any visible damage on the outside of their eye. After that, we can use a very handy tool called an ophthalmoscope that allows us to look inside of their eye, look at the back of their eye, see their retina, see if there's any damage, any tears, any blood in the back of their eye, any debris in the back of their eye, anything that would indicate to us that they're having trouble seeing out of that eye. All right, after we have examined our eyes, checked out the eyes for any problems, we will then move on to our bird's wings. So when we are examining our bird's wings, as you can see, it is very, very hard to see under the feathers. These birds are completely covered from head to toe. It would be hard for us to see any injuries they have. So when I am examining a wing for any potential problems, I'm primarily using my sense of touch. I'm feeling the wing all the way down the bone to kind of check for any fractures, maybe any scabs, any open wounds I might feel. If I feel like there's a problem in a certain area, I might be able to part some feathers and really get a closer look at that area. If I were to find any scabbing, any open wounds, I would go ahead and clean out that wound. I would flush it out and then disinfect the area and then put on a bandage. If I were to find any broken bones, I would make a cast for that. So what we can do is we can kind of align those bones to make sure we want to absolutely have them heal back in a straight line. We don't want them healing crooked or anything. So we want them to heal properly. What we'll do is we'll take their wing and kind of make a bandage so it holds that wing in place, allowing or kind of restricting their movement and letting that bone heal straight. After I've checked out my wings, look for any damages on the wings, I will then check out a bird's legs and feet. So with the legs, I'm kind of doing the same thing that I am doing with their wings. I'm feeling their bones all the way down their legs, checking for any scabs, broken bones. We treat them in very similar ways. We'd disinfect any wounded areas. We would make a cast for their leg, hold that in place, let that heal properly. So then I move on to my feet. We have a very, very common injury that we see on a bird's feet. It's called bumblefoot. So that is basically a giant sore on one of their feet. And they get that sore because, let's say they have one injured leg. Of course, putting your weight on that leg would hurt a lot. You don't want to do that. They don't want to do that. So what they'll do is they'll kind of balance on one foot, putting all of their weight, all of that pressure on just one of their feet. And that can create that giant sore on the bottom of their foot. So what we do for that is we can take some padding. We can wrap it onto the bottom of their foot, kind of create a layer, something like a shoe or a boot. So when they put all that pressure on that one leg, it's not going to damage the bottom of their feet. After I have checked out my legs, my wings, and my head, I move on to the body. So when I am assessing a bird's body, we like to take what is called a body condition score. So where we have our sternum right here, birds have a keel bone. This is the attachment point for all of their flight muscles. And we can generally look at those muscles on their keel to determine how healthy that bird is. So we have a scale from 1 to 5 here. If a bird is in the 3 or the 4 range, having a good amount of muscle on that bone, making a 10, they're a healthy bird, they're eating enough, they're flying, they're absolutely using those muscles enough. If a bird were to get up to the five, that might indicate that that bird is overweight. We don't often see this at the hospital, but birds under human care, if we can see their keel kind of bubbling over that bone, uh, that might indicate to us that maybe we want to reduce their food intake a little bit. If a bird were to be around a one or a two, so that would indicate to us that that bird is very skinny. It can kind of tell us if there are underlying problems. So maybe a bird that is really skinny like this, maybe it's not eating enough food. Maybe it can't see out of some of its eyes, so it can't catch anything. Maybe it hurt one of its wings, so it's not using those muscles enough. So they're kind of atrophying. They're going away because it's not using them. So if we see a bird at a one or a two, that can kind of tell us there are underlying problems that we need to look for. All right, and after that, I have assessed the general health of my bird. If we think that bird is able to be rehabilitated, if we accept it into our hospital, if it can go back into the wild, we will admit it into our hospital. We'll care for it. Like I said earlier, we deal with wild patients, and they absolutely do not like being around people. So we don't house our birds inside of our hospital. We keep them in outdoor enclosures that can kind of let them be more in their natural environment, let them hear the sounds that they're usually hearing instead of the noisy inside of a hospital. So we keep them in outdoor enclosures of varying sizes depending on what they need and how far along in the process they are. When a bird just gets into the hospital, we have them in tiny enclosures, tiny condos that allows us to have easy access to those birds to give them their medication, any treatment they need. Maybe they need wound care, any bandage changes, things like that. As a bird heals and as it kind of progresses in the rehabilitation process, we will move them into larger and larger enclosures where they will be able to fly around. A lot of the times, our birds being in those tiny condos where they first start out, they're of course not flying enough, they're not using their muscles enough. So as our birds get farther along, we also exercise them. We'll have them fly back and forth in those larger enclosures to kind of build, build that muscle. Um, and when we think our bird is flying very well, all of their injuries are healed. We can't see any underlying problems with them anymore. We think they're good to go back into the wild. We will do a final evaluation, a flight evaluation of them, where we look for several things. The first thing we look for when we're evaluating a bird's flight is we want them to stay steady. We don't want them dipping down when they're flying. If they're dipping down, that might tell us that maybe their muscles aren't built up enough. Maybe they need to do more exercise. If that bird... Right, that is our red-legged Sariyama bash. He likes to scream all the time.
Red-legged Sariyama bash.
2 miles away.
We'll go see her in a minute.
It's just down that they know she was nugget.
It sounds like laughing.
Yeah. When we're evaluating flight, we also want to make sure they're not wobbling. If they're wobbling, that might tell us that they're favoring one side of their body. Maybe one wing is flapping a little stronger than the other, making them go one direction and have that wobble. Another thing we look for is, are they perching? Are they landing well? So when they're flying from place to place, we want them to be able to land on that. We don't want them to miss. We don't want them to be able to not make it there because maybe that means their eyesight is bad. Maybe that means their wings are damaged a little bit, so they can't slow slow down like they normally can. Finally, we want them to glide. That also shows us that they have the appropriate amount of muscle that lets them kind of generate that force to glide across without having to flap the entire way. And if our patient shows us all of those things, that it's flying well, that it's landing well, that it can see well, it will be deemed releasable back into the wild. So we will go ahead and put that bird back where we found it usually. We generally try to always put them back where we found them. Sometimes that's not possible. Sometimes if a bird comes to us from getting caught in a fishing line, we don't want them to be close to that fishing line again. So sometimes there are dangers in that environment where we found them, where we would maybe put them somewhere else. But generally, if we think where they came from is a good spot to put them back at, we will contact the finders, ask them if they want to be involved in the release. They can come and see us release that bird back where we found them.
They just gave it to us.
Yes, and that is our rehabilitation process. Does anyone have any questions about anything? Yes?
They didn't ask us if we wanted to watch them release it. They gave it to us to drive 2 hours back down the road to release it back in.
That depends. So in the general Charlotte area, we admit most of our birds, our retrieval process is 100% volunteer based and based on
2.5 hours
who
on the
calls
road.
us. So a lot of the times we don't have volunteers that can go out very far to get birds, maybe in like Raleigh or in the mountains. So most of our birds come from the general Charlotte area or a little bit outside of that. If the finder is willing to bring that bird to us, they can absolutely come from all around the state. But we also have a large list of resources, so if someone were to call us from far away, we would be able to give them the number of someone who can help them. We also have that list of resources in case someone calls us with a non-raptor. We are a raptor specialist facility, so we don't take in anything other than raptors, but we can give them the number of someone who can help that animal.
How do they tend to tolerate to their wild animals when they've got pets or abandoned? I'm guessing.
Yeah.
Not really.
No, so we generally, when they have those bandages, we have to check on them every day, because, having a cast on is uncomfortable, and they don't know why they have it on. It's just a thing on their body that doesn't feel great. So they'll, a lot of the times, they'll try to pick at it, they'll try to get it off. Especially owls. Owls are very prone to picking at their bandages. So sometimes we have to reinforce those bandages. We'll put tape on them. We'll make little tabs on the bandage that they can chew on so they don't destroy the actual helping them. But yeah, we very, very often have to change those bandages and make sure they're still on. Do we have to do a lot of surgeries? Not often. So a lot of the times when we have those bone fractures, is one reason why we would do surgeries, but a lot of the times we'll try to align that bone just from the outside because a bird's skin is very, very thin, so it's very easy to access that bone, so you can kind of line it up and then hold it in place so it can heal properly. If we're starting to see that bone isn't healing properly, or we have an extra, if we have an extra difficult case, our wonderful veterinarians are able to implant a metal rod into that bone, kind of holding it in place. But I think that's something that doesn't often happen. Yeah. Yes. So another thing we do if we find broken bones is we take X-rays of their body. healthy bird. But yeah, a lot of the times we have to x-ray that bird, and they're not just going to sit on the table and sit still so we can look in their bodies. So sometimes we will have to anesthetize them if we have any procedures, like I was saying, if we're caring for their wounds. We also will have to anesthetize them for that, just to keep them from moving around, potentially hurting themselves more. Yeah, we do
I
often
just
do
want to ask
that,
the
of course.
questions and nobody wants the answer. Well, you don't know.
Any other questions? Yeah, absolutely.
You said you're an intern. Are you
Yeah.
studying like wildlife management or veterinary science or
Yeah, so I'm
interested in
Read a
animals?
lot.
yeah, so I'm currently pursuing my biology degree, with the intention of working with animals, doing things like this in the future. But I absolutely intend on working in
Everybody
rehab
saw it.
facilities in the future. And this is a wonderful opportunity to kind of get into it. Anything else? All right.
How many people work there at the hospital?
I think around 8 staff members.
It's mostly like vets and volunteers, or
We don't have any full-time vets on staff,
oh,
but we are contracted with 2 veterinarians that will come in once a week and care for our birds.
interesting.